Good morning, everybody. My name's Dave Medeiros. I'm the president of the Chesapeake Region Safety Council. I wanted to let everybody know I am sporting a new hairstyle today. It is called a wife-provided COVID cut. So some of you older people remember back in the day where everybody had a Beatles haircut. This is called a COVID cut. All right. Good morning, everybody. I hope everybody's in good spirits this morning and ready for some new information. But once again, my name's Dave Medeiros. I'm with the Chesapeake Region Safety Council. We are a regional independent chapter of the National Safety Council, and our mission is to educate and influence people to prevent accidental injury and death. In addition to being a chapter of the National Safety Council, we are also part of the Mid-Atlantic Osha Training Institute Education Center. So we are an OTI Ed Center in Region 3 of the country. And one of the exciting things we are about to start to deliver, we are going to deliver our first one. It's a virtual instructor-led training program. We're going to deliver that tomorrow. That's going to be a WebEx program. And it will be a numbered OSHA Training Institute course. It's the 7405, Fall Protection in Construction. So just want to let you know, we are working diligently at trying to get ahead of this virus thing and be able to continue to deliver quality training to everybody. So stay tuned, pay attention to our website, and look out for new and different things as we move forward. So that's about all I have to say. I just want to introduce our speaker today, and probably anybody and everybody that's in the safety world has heard from this lady, and she is awesome. Adele Abrams from the law offices of Adele Abrams is going to deliver a presentation on COVID-19 in the workplace, the next steps to reopening. And I know we're all sitting on pins and needles waiting to get reopened and get back into action. So without a whole lot more, I want to introduce Adele Abrams. Adele, take it away.
Okay, thank you, Dave, and good morning to everybody. I don't think anybody's in the afternoon state of things here. And we're going to cover a lot of material here over the course of the next hour and a half. So stay tuned for that. And I'm going to actually shut down my video, I think, just so that I'm not distracting you all. And as Dave suggested, we're going to be giving an update here today. I did a webinar for Chesapeake Region Safety Council on this topic right out of the gate back in early April. And obviously, a month later, a lot has changed. And while before we were looking at the best ways to hunker down in place, now we're looking at what are we supposed to do as we start re-emerging from our little hidey holes and re-enter the workforce or bring our workers back. And this is going to be different depending upon what industry sector you are in. So first of all, high level COVID-19, what is this monster that we're dealing with? The invisible enemy, as they say on TV. Well, it's a respiratory disease. It is not a cold and it is not the normal flu, that's for sure. And at this point, it is a worldwide pandemic. I'm not even going to attempt to throw in any kind of body count number here because it is changing so rapidly. There are still many areas that are on lockdown, among them Maryland for the most part, DC, Virginia, Pennsylvania, Delaware, the states, West Virginia that we tend to deal with Chesapeake Region Safety Council. But there's still a phased reopening already going on for critical infrastructure workers and others who were considered to be an essential service. Even law firms are considered essential. I think probably that would be open for debate, but certainly we have been allowed to stay open during this pandemic. Now, what we're looking at, and we'll talk about this a little bit more, is the so-called resumption of normal operations in a phased approach. And the federal government set out some guidelines on how to approach that back in the middle of April. Phase 1, phase 2, phase 3, but they deferred to the state and local governments as to when they were going to reopen the sectors. And as we've seen, a lot of the states have just blown right through those federal guidelines. Typically it was saying once you've had a decline in your cases and your deaths for 14 days straight, then you could think about reopening. Well, they went from 0 to open in about a nanosecond in some of these areas. And unfortunately, I personally think we're going to see a bad backlash from this. I think in many cases it was premature. If anybody has seen some of the footage, whether it's the California beaches or the Florida beaches or some of the stores, very few people seem to be doing what has been recommended, which is social distancing and wearing the cloth face masks. Dave mentioned calling them sneeze masks, and I like that. I'm going to steal that from him because they are not respiratory protection. They are simply to protect the other guy if you happen to be infectious, even if you are asymptomatic. But when you go out and you realize, you're one of the few people wearing a mask in your grocery store or pharmacy, it doesn't bode well for how things are going to be handled by the general public. Now, the workplace is a different matter because obviously there are regulations that apply there, and we're going to be focusing on that for the most part here. But, your workers are people. They are out in the grocery stores and the pharmacies and whatever other, beauty salons, massage parlors, tattoo parlors, whatever else gets opened up. And then if they are not following the appropriate procedures, they can bring the COVID-19 illness into your workplace. So, you have the community transmission, it's true, but that has ramifications for the workplace. And then you have the flip side of the coin, which is work transmissible. A few minutes, we're going to talk about that in more detail from Osha's perspective. But basically, you've got this cross-transmission potential where if people are cavalier when they're out in their day-to-day activities about protecting themselves, all the protections in the workplace may fall apart if your workers are carpooling into work together, for example, when you are not in control of that situation. And similarly, if you are not practicing appropriate protocols in your workplace, those workers who perhaps become infectious are going to go back into their communities, perhaps vulnerable people in their households, the grandparents, the parents, children who have immune diseases. We're still learning so much about this disease. And that is truly, to me, the scary part about any potential premature reopening, because while we've been focused on the respiratory aspects of this, the fact is they are finding younger people are developing this weird blood clotting disorder that is taking out some people from heart attacks and strokes in their 20s and 30s. And just yesterday, the new information was on clusters of children, young children developing a rash and some other symptoms that they think may be a side effect of COVID-19. So we are, even though we've been dealing with this, if you count the outbreaks in Asia since last fall, but certainly in the US for several months now, there's still an awful lot we don't know. So bear that in mind, that this is continually evolving. Now, in terms of the symptoms, there are a variety. I'm going to go into this in more detail in another slide, but the important thing to remember is that the symptoms can appear anywhere from 2 days to 2 weeks after initial exposure. And more as they are rolling out testing now, they are finding that many people who are testing positive for COVID-19 were in fact asymptomatic or had very mild symptoms. And that is going to be the real stumbling block for all of the companies that are saying, well, we're just going to go with the thermometer, and as long as you don't have a fever, pick a number, because again, it's different from state to state. But if your temperature is over 100.5, you can't come back to work. Well, that's fine, but what if you are asymptomatic or you're one of the 30% of people, even if you have other symptoms, who don't run a fever? Those are going to be really problematic issues. Viruses spread person to person, the 6-foot rule we're talking about, right? The 6-foot rule isn't a rule. It's what I call a swag, a scientific wild ass guess. For the most part, if you are 6 feet apart, you're going to be good. But again, more recent studies looking at joggers, for example, have found that if you are, trailing a jogger and they have infectious respirable particles, they can stay airborne for 13 feet. They can be suspended there. So 6 foot, a good rule. We have to pick a number, so why not that? But be aware that that is not 100% slam dunk that you're going to be safe. In addition to staying 6 feet away from people and wearing the sneeze masks, it can be transmitted as well by touching objects that have been infected with the virus and then touching the T-zone, which is not anything sexy. It's just your eyes, your nose, and your mouth. So, we have now a new round of paranoia about, handling our mail, handling our packages that come in. If you may be looking at your frontline workers on the assembly line, but are you thinking about protecting the person in your mailroom who may be processing this material that can still be contaminated for anywhere from 24 hours to several days. So these are some things you're going to have to consider in terms of your total risk assessment. Is not just those people who are high exposure because they are elbow to elbow with a coworker, but also those people who have ancillary functions that could bring them into contact either with members of the public or handling things such as mail and packages. Now, whatever industry sector you're in, as you open up and return to work, you're going to have to either update your infectious disease plans, if you had them, to address the novel issues of COVID-19. The word novel is right in the name of this virus, and this does act in ways that we're not familiar with. But you're going to have to consider your specific exposure risks, the sources of exposure, how are you going to address things like community transmission, and the unique characteristics, because this is not just the flu. The flu typically does not cause blood clots, for example. Now, if you don't have a current plan, you need to get one. You need to anticipate that there's going to be some failures if you don't have good continuity planning. You're also going to have to consider issues, and this is a big one for me because I've handled a lot of fatalities over the years. Make sure that if you're having people fill in for other workers, especially in safety sensitive positions, that you refresh their task training. If they haven't done that task for a while, they haven't operated that equipment or used those tools, make sure they know how to set the guards on the grinders, make sure that they know, how this model of front end loader operates. If last time they did it, they used a different make and manufacturer, because this is where the trap doors are. You really need to have some JHAs, review them with whoever the fill-in employees are going to be, and make sure, that you are covered there, and document that training as well, of course. Beyond that, a lot of OSHA's guidance, and I'm going to give you a couple of different sector examples here in a few minutes. It's really based on traditional infection prevention and industrial hygiene practices. Certainly CDC, NIOSH, and OSHA are all trying to work somewhat in tandem. They have different audiences, though. Remember, Centers for Disease Control is really looking at public health, whereas NIOSH and OSHA and Msha, I'm going to give a shout out to the Mine Safety and Health Administration because they're in this too. They focus on workplace safety and health, the protection of our most valuable resource, the worker. It just comes right down to that. So we now have an updated list of COVID-19 symptoms. When I spoke to you before, if you were on that call, we talked about fever, cough, and shortness of breath. Those were really it. Now they're saying if you have cough or shortness of breath or difficulty breathing, or if you have 2 or more of the following symptoms: fever, chills, repeated shaking from chills, but maybe you don't have a fever or chills at all. If you have muscle pain and headache, that would be enough to be potentially considered. A lot of people I know, have muscle pain every single morning. I did a 5K yesterday and I could barely walk upright today. I'm just saying. But the fact that your muscles hurt does not necessarily mean you have COVID. Headache. Lots of people get headaches fairly routinely. Sore throat. These standing alone may not be enough to get your attention as a worker or as an employer. And this is the devil in the details, because, OSHA and CDC are saying if you have two of these symptoms, consider yourself potentially infected. And then the big one is a new loss of taste or smell. And that seems to be a really distinguishing characteristic. At this point, I've had a number of friends and some relatives who have tested positive, and that loss of taste and smell seems to have been a fairly common characteristic. Now, they also say that they don't want people just routinely running to the doctor over this. And testing is being rolled out in a very haphazard manner. We would probably need another whole webinar just to deal with testing issues. But there are three different types of tests. You've got the test to determine if you are currently infected. You've got the antibody test and the antigen test. The antibody test will show if you've had it, or at least you've had a significant exposure enough to create antibodies. But the wild card in this is we don't know that that's protective. We don't know that if you test positive for antibodies or COVID-19 antigens, that means that you are not going to be infected again. There are some cases already that we are seeing in other countries where people who were previously considered to be cured have become reinfected. And again, ripped from the headline stuff as of May 5th. This morning I saw in Louisiana, there were 2 people readmitted to a hospital who had been cleared as cured, and they now are infected. So they don't know whether this is a reemergent situation of their previous infection or whether it's a new acquisition, so to speak. So these are a lot of the variables that we really can't predict at this point. But OSHA, CDC, they say, certainly, while we don't want you just running to the doctor for everything, if you're having trouble breathing, if you're having a persistent pain or pressure in the chest, go to the doctor. And heart failure, heart attacks have been coupled with this as well. New confusion or an inability to be awakened. You probably won't be aware of this. So this is where your significant other comes into play. And if they tell you that you're acting a little crazier than usual, that might be something to take seriously. And then bluish lips or face, that certainly indicates a lack of oxygen. What we're hearing now are things of people sitting there, swiping their cell phones and talking and seeming perfectly fine, and then dropping like flies because the low oxygen levels are not, immediately perceptible. So those, the oxygen measurement devices, they're not recommending those in the workplace yet, but that is certainly something you could consider if you can get them, making them available to workers. And remember, this is not an all-inclusive list. Another thing that has been mentioned I didn't even put on here are COVID toes. Yes, we have a thing called COVID toes now, where discoloration on your toes and feet may be a sign that you have had COVID. So again, many wild cards here, and we're going to proceed now through the rest of this based upon the best information that we have available. So Congress, I want to give an update on what they're about, because this is a change since the last presentation. There was a different bill number that I discussed last time for those of you who participated, and that was the old bill, which of course is still pending before Congress, but it's been superseded. The old bill would have forced OSHA to do an emergency temporary standard or an ETS to require a COVID-19 or infectious disease rule for the healthcare sector. That was then. This is now. The new legislation is HR 6559, and this is the Every Worker Protection Act of 2020. This would still, like the other one, require OSHA to issue an emergency temporary standard within 7 days of passage. That's pretty quick, based upon the CDC guidance. So they're benchmarking it to something concrete, but they would have to have this in place to protect all workers from exposure to COVID-19 in the workplace. Again, previous rule, and in fact, the OSHA 2015 infectious disease draft rule that went through the whole small business review process, that was limited to the healthcare and death care sectors, laboratories, and some ancillary services to the healthcare and death care sectors. They also included correctional facilities and drug treatment programs in the scope of that, as I recall. But what they're realizing now is that this is an equal employer, so to speak, equal opportunity employer. You can be working in a shoe store and be just as likely to catch this if they're not appropriate precautions taken as if you were working in a dentist office. So the scope of this has been expanded, and this has major ramifications because this is kind of drawing a line in the sand. And down the road, in the next administration, perhaps, if OSHA embarks on a rule, assuming that this legislation doesn't pass, they're going to have to really rethink whether to limit the scope of that to the healthcare, death care, and corrections sectors, or whether we really do need to have this as a ubiquitous standard, similar in a lot of ways to the bloodborne pathogens rule, which initially came out of the healthcare sector, but I've had clients in retail stores get cited for not following that bloodborne pathogen rule. Under this rule, under this legislation, in addition to the temporary standard that would have to be issued within 7 days, OSHA would have to finalize a permanent standard within 2 years. And that's, something of a reasonable track, especially since they did have a draft rule already created. On OSHA's regulatory agenda, by the way, this is on what's called the long-term action, which means that there would be no action at all taken on the rulemaking for at least 12 months. And that was as of the regulatory agenda that came out in November. The new one for spring should be out any day now, and we'll see if they have changed that up. I also want to mention that in the COVID relief legislation that has gone through, the Democrats have made an effort twice now in the two different bills, version 2 and version 3, to include this language in there to force OSHA to do an emergency rule. But although it was in the House passed bill, it was not in the Senate version, and so that has not come to pass. That is another avenue they may take on this if they have to do a third or fourth relief bill. So stay tuned on that. Now, in this legislation, they're in addition to requiring there to be an infectious disease standard, specifically, this legislation would require OSHA to forbid employers from retaliating against workers who report infection control problems to the employer, but also to public authorities, that would be OSHA or CDC or NIOSH, but also to the media or on social media. And that's kind of big because there have been these retaliatory situations. I will note that the National Labor Relations Board has some opinion letters out on social media and what employees can and cannot say on there without it tripwiring the ability for employers to get rid of them. So you may want to take a look at that. But, if somebody's coming home from work, and saying it's god awful in there, my employer's not doing anything, I'm really afraid I'm going to be sick, and the employer finds out about that and fires them, that would be illegal under this. Right now, Section 11C, OSHA might or might not take that. Probably wouldn't, and we're going to talk about that in a little bit. National Labor Relations Board might take that case, though, and they have a 180-day statute of limitations versus the 30-day for OSHA. So for employees who are listening to this, you do have some recourse, and NLRB will listen to you even if you are not at a union operation. So don't get confused over that. The other thing in this legislation is that it would protect workers who want to bring their own higher level personal protective equipment in where the employer is not providing appropriate PPE. It would prevent the employer from barring workers from doing that or from retaliating against them. Another big one here is that it would protect public sector workers in the 24 federal OSHA states where they currently don't have protections. Just to give you an example, Maryland, Virginia, they're both state plan states. They have to cover public sector workers just as a function of getting their state plan approved. But federal OSHA has long claimed that they lack jurisdiction over state and municipal employees. Some of the states, New Jersey, New York, Connecticut, which are federal OSHA states, they've passed their own state unique laws to protect their public sector workers. Other ones, Pennsylvania, for example, Delaware, they haven't. So those are the hospital, nursing home workers, VA workers who would be covered under this. So bear that in mind. That's probably a good thing. Now, it would also give OSHA some citation discretion over personal protective equipment citations in healthcare or other covered employers where there's a good faith effort to purchase the appropriate PPE, and this is important, and they are giving alternative methods of protection to their workers. You can't just say, well, I tried to buy them and they were too expensive, so I'm just letting everybody work barefaced. That isn't going to be enough. You're going to still have to try to protect your workers. And then finally, it would require CDC and OSHA to provide additional recommendations. Now, California, Cal OSHA, has an aerosol transmissible disease standard. And you may be wondering, why am I talking about Cal OSHA when we're here in the Chesapeake region? The answer is this, first of all, is already in effect. So some of you on this call may have operations in California and not realize that you might have to comply with this rule. But the second is, since this has been shown to be a feasible rule, it's been in effect for several years now, this very easily could be the model for a future OSHA rule spanning a variety of industry sectors. And Cal OSHA, of course, has their own COVID page. I've given a link to that. They have jurisdiction concurrent with Msha over mines, too, which is another little fun fact. That's the only state that does, by the way. But Cal OSHA, just like I said at the outset, they advise employers to review their own procedures, review the guidance from the agency, but relative to their aerosol transmissible disease standard, these are the elements. There's a written exposure control plan and procedures, training, engineering and work practice controls, personal protective equipment, medical services, including a vaccine if anyone ever becomes available and is proven to be safe, but also infection determination and treatment, and that would have to be at the employer's expense. And then there's some provisions for laboratories as well. And I was looking at this and the various aspects of this and kind of laughing to myself that I do a lot of work on the silica rule. This is almost like a silica standard, very quite a few of the same elements there. So in that way, maybe that helps demystify this a little bit. You're able to do this for a lot of other high hazard substances, asbestos, arsenic, cadmium, beryllium, silica. You know how to do this, employers, so don't get freaked out over this. Use those same protocols to assess this health risk and then manage it intelligently. So in terms of a future federal OSHA rule, the scope of it was, as I said, the healthcare, death care, correctional, homeless shelters they had included in there as well, the drug treatment programs, but they also indicated occupational settings where employees can be at increased risk of exposure to potentially infectious people. Just to throw it out there, meatpacking plants were not on the list back in 2015 when this got started because of Ebola, by the way. But now meatpacking plants are a huge source of cluster type infections. So perhaps they would be specifically enumerated in a future rule. This again is evolving in real time. On OSHA's long-term agenda, they noted that this could be expanded in scope as well. So let's take a look now at some of the OSHA enforcement guidance that has come out. There's been a number of memos that came out since we last did this presentation. There were a couple in early April, and I have links to a few of these dealing with personal protective equipment and waivers on things like fit testing. Some of the medical evaluation issues. And then they came out with a couple of important pieces of guidance dealing with enforcement. One on April 13th, I think it was, and then one on the 16th. So the one on April 16th was directed not at the employer community, but rather at OSHA itself, the regional administrators and the state plan administrators, again, such as Maryland and Virginia and the Carolinas, urging discretion in enforcement when considering an employer's good faith efforts during the pandemic. So on one hand, this makes a lot of sense. They are recognizing that they have limitations in terms of their inspection resources. Little fun fact, in the 2020 Labor HHS Federal Appropriations Bill for OSHA, the House Appropriations Committee noted that OSHA right now has the lowest number of inspectors in its history since it was created in 1970, and that with the current number of inspectors, they could visit each work site once every 165 years. So clearly, they cannot be in every mom and pop operation policing, whether you're wearing your respirators correctly. And so they're trying to maximize the use of their inspectors by not going down rabbit trails, basically. But what they're saying is if OSHA does come in and inspect you, the COSHO, that's the inspector, stands for Compliance, Safety, and Health Officer, they will assess the employer's efforts to comply with the standards that require annual or recurring audits, reviews, training, or assessments. Now, let me stop there, because that's really what they're looking at in terms of discretion in enforcement. It's the stuff you can't get done because you can't get your third-party auditors to come out and check out your operation. You're having problems with training getting done because either you rely on third-party sources, thanks to Chesapeake for putting some of the stuff online now, but also, you don't want to have huge groups of people sitting together in a training room. And so those are the things they're focusing on. They are not totally giving discretion in enforcement for everything. Where I happen to be sheltering in place, there's a new house being constructed on the street across from me that I can view from my window. And those folks are up there, not wearing fall protection, when they should be. And I think there is this mentality out there that it's the wild, wild west right now, that OSHA is going to be so busy chasing its tail over healthcare that they're not going to be policing anybody else. That is not true. They are still out there. They are still responding to fatalities, to major industries or catastrophic events. If they're driving around and they see an open trench, with a ladder in it, they may still stop and see if you have a trench box in there. If they're driving along and they see you, doing a pirouette on an I-beam with no fall protection, they are still going to intervene. But the get out of jail free card that you have here under this April 16th memo, they really are looking at the things that are directly impacted by COVID-19. So if you're not in compliance, they're going to assess and also document what you did to ensure that workers were not exposed to hazards from either tasks, processes, or equipment for which they were not prepared or trained. In other words, did you give them some virtual training? Maybe one of the Chesapeake Region Safety Council's programs. Did you have some remote communication with them that, you sent them maybe JHAs that they could read and review in advance of coming back to the workplace? What did you do in terms of engineering and administrative controls? Did you make any efforts to reschedule the activity, and how quickly? Now, if you've made no effort to comply, you're going to get cited. And in order to ensure that corrective actions are going to be taken once things get back to whatever the new normal is going to be, OSHA plans to develop a monitoring inspection program, and they're going to go back and they're going to randomly sample these work sites where they deferred citations. And so, if you were fast and loose during COVID-19 and they come back after, we're in the new world order, and you're still being fast and loose with your safety and health protections, the hammer is going to come down. And in fact, in my view, if they deferred a citation and told you what you needed to do, and you still did not respond to it by the time they come back, that is likely going to be a willful violation. That can be $134,937 per exposed employee. So bear that in mind. Right now, this enforcement deferral is in effect until further notice, but it is specifically time limited to the current crisis. The president's emergency declaration has already expired as of April 30th. So now that leaves this in a little bit of a limbo situation. You're going to have to defer and look at what the states are doing, I guess, since the feds now no longer have any set protocols in place. Now, what are they giving deferral on in terms of enforcement? As I mentioned, it's not everything, but annual audiograms. Nobody's probably going to die from having a delayed hearing test. Your annual process safety management requirements, many of which do require third-party auditors to be involved. They recognize that there are problems bringing strangers into your work site. Hazardous waste operations, the HAZWOPER training. Respirator fit testing and training. But OSHA has made this clear. It's the annual fit test and the annual training for personal protective equipment for respirators that they are suspending. It's not the initial testing. So if someone has never worn a half-face respirator before, you can't just give them one and say, well, we can't get you fit tested, but hope this works. You also have to inform your employees under the OSHA memo why they are not getting their annual fit test or training, and you have to let them know that they need to report to you if they're having problems with their respirator fit, or if they perceive any deficiencies or any problems with their respirator. They've also suspended maritime crane testing and certification, medical evaluations to wear a respirator. And again, this typically is going to be a reevaluation, but you need to reschedule the spirometry test once they lift the suspension. And this is according to the American College of Occupational and Environmental Medicine. So they have some good guidance out as well. If you are the industrial hygienist for your company, you probably want to take a look at what ACOEM is doing. And I've given you the link there so you can read the rest of this enforcement memo for yourself. Now, a few days earlier is when the real bomb landed, in my view, and I've given you the link here. This was the April 13th guidance to OSHA area offices on enforcement procedures, hazard alert letters, accident and incident investigations, and also how they are going to triage the complaints that they receive. This thing is huge. It really is. It warrants a very detailed reading, more detail than I can give you certainly at this point here. But basically, what they're saying is we're going to be throwing a lot of our enforcement resources over to the healthcare, death care sectors. And so therefore, if they get a complaint at your local OSHA office about COVID in the workplace, my employer's not protecting me adequately, I wasn't given, PPE, I'm having to work too close to my neighbor in our cubicle farm, whatever. If it is a non-healthcare and non-emergency services employer, these are going to get processed as a non-formal complaint. Using the field operations manual procedures, which basically means they're not going to send an inspector out to the work site, interview employees, open up a big old Section 11C investigation, or they have the analogous power now under Section 1904 of Title 29, which is the injury and the illness reporting and recording. Remember, 1904.36 does protect workers from retaliation, not only for reporting that they're ill or injured, but also for any of the rights that are protected under Section 11C. So there are two different ways that OSHA has for processing these and issuing citations even. However, if you are construction, you're manufacturing, you're retail, at this point, all they're going to do is send the employer a letter saying, we had a complaint about X, and then the employer gets to respond to that letter. And typically, as long as the responder writes back and says, well, we checked into this and no, there's no problem here, or we checked into this and yeah, we found that we should have had more of these, and here's some receipts, we've just bought some new masks. At that point, that's the end of it. It does not clarify at this point what happens if the worker has been terminated already in a non-healthcare setting. Is OSHA going to take that case? The only thing I want to note here, it's not in my materials, is that there are, I believe, 36 states who have held that OSHA Section 11C is not an exclusive remedy. And so you can still bring a wrongful discharge action, even if you're an employee at will, under what's called the public policy exceptions to employment at will. So if OSHA lets you down and they won't process your complaint, you do have some recourse in the state courts for the most part. Now, OSHA also says if an employer has a severe injury report where somebody dies, you still have to notify them within 8 hours. Or if you have somebody who is hospitalized or who has an amputation or the loss of an eye, you have to notify them within 24 hours. But OSHA put right out there in this published document that most of these, except for fatalities or 2 or more people being hospitalized, they're going to be handled through their RRI process, which is the Rapid Response Investigation Letter. Again, very similar to the complaint. They send, you notify OSHA that you've had an incident here. They're going to send you this RRI letter, and as long as you respond, typically it's 5 calendar days. They're probably going to give you some latitude on that right now. That's it. They leave it alone. Occasionally, if you put information in your RRI response that admits to violations, or is very cavalier about how you're treating your workers, OSHA may get interested, and resources permitting, they may pay you a visit. So don't think that you're 100% insulated from OSHA following up on these. But, again, my opinion, I think this memorandum they put out really sends a wrong message to employers that you can kind of mistreat workers in a non-healthcare setting, and right now OSHA is not going to be terribly concerned about it. So if you are an employer on this, you're probably one of the good actors anyway and would not do that, but don't do it. Just don't abuse and misuse and retaliate against your workers. Beyond that, this OSHA enforcement memorandum of April 13th assigns the risk levels, and that is how they are going to triage their inspections, their hazard complaints, everything that brings them to your doorway. If you are in a high or a very high exposure category, you're going to get the most resources. Hospitals, emergency response facilities, nursing homes, for sure, those are probably the most hazardous settings right now. And, my godmother died in a New Jersey nursing home last month from COVID. So we're all being touched by this. Those of us who still have elders of the tribe available, who are still alive, it's a very scary time. Laboratories, and also medical transport, ambulances, for example. Those are the high and very high exposures. Then they move down to the medium exposure sectors. Those are ones that have frequent or close contact, where you typically have to be within 6 feet of other people who could be infected, or if you're having regular contact with the general public. So as these hair salons, nail salons, massage parlors, tattoo parlors, retail stores, resume their operations, those would be considered likely in that medium category because you're interfacing with the general public. And then finally, you have the lowest exposure category, those who don't require contact with people who are known or suspected to have illness. You're not dealing with the general public in close contact. You're not in close contact with coworkers. Your truck driver, You know, that could be an example of that. You're staying in the cab of your truck all day. You're not going into anybody's houses or into any buildings. You know, you stay in your truck, somebody else loads it at the start of the shift. That might be a way of insulating your exposure. But you're really, as an employer now, going to have to sit and use this framework to analyze where you fall in terms of low, medium, and high risk. Now, OSHA has a bunch of other information out. As I mentioned, there were a pair of memos that came out on April 3rd. One of them allowing the use of respiratory protection equipment that's been certified by other countries, but not in the US. These are primarily the N95 respirators, which also theoretically provide 95% particulate protection. What I am hearing, just anecdotally, is that these KN95 masks are failing fit tests with an alarming amount of regularity. And if you are waiving your fit tests, per OSHA's memo, that's a scary situation, because you may be giving workers these KN95 masks and they think that they're going to be having equivalent protection to the N95, and yet, they may not, because of deficient manufacturing or production standards. They also issued a memo on that same day dealing with, again, the N95 shortage, allowing the masks to be used past their expiration date, and also allowing reuse of the masks, cleaning them, for example, following certain protocols. Again, a lot of detail in these. You want to mine down into that if it affects you. But remember, these N95s are theoretically disposable masks. That's the intent. And I was chatting with our moderators before we got started. I have a very real concern that, between allowing the use of these, reusing these, using off-brand ones, using cloth sneeze masks, we may have some backlash here, where employees become a little bit too loosey-goosey, that's a technical legal term, by the way, with how they're using their PPE. And if you have workers who think they can put a cloth bandana around their face and they're good to go in terms of silica, when Table 1 in the OSHA rules says you have to wear an N95 mask or an APF 10 respirator, you're going to be in some trouble. You're going to be out of compliance with that, and that is not going to be like for the silica rule or beryllium rules. They're not going to give you a pass on those the way they would if you're simply using these to avoid COVID transmission in the workplace. So be really clear on what you do get a free pass on right now and what you don't. They also put out temporary guidance on the fit testing on April 8th. Another memo that had come out in March allowed this. This is what I'm talking about, the pass on the annual fit testing, for example, but it was restricted to the healthcare sector. In this memo that came out on April 8th, they expanded that to all industry sectors. So that was a major change, but it is temporary. So you're going to have to keep an eye out for when OSHA rescinds that permission, because then you're going to have to make sure that you have an adequate supply of appropriate, APF 10 respirators. You're going to have to make sure you've got your fit testing in place or scheduled and be on the right path again. Also, going back, it seems like ancient history now, on March 10th, 2020 was when OSHA put out the big enchilada, which was their 35-page guidance on preparing workplaces for COVID-19. I've given you the link there. There's still good information there, and it does address a variety of different industries, so it's probably a good starting place. But bear in mind, this was written 2 months ago, and we know a lot more about COVID now than we did 2 months ago, and there's probably a lot more that we still don't know about it. OSHA has a landing page for COVID. I've given you the link there. So does the CDC. And so, these should be considered and bookmarked as primary sources. There are a lot of associations and various trade groups, labor unions that are putting out guidance on COVID as well. Some of the state plan OSHAs are putting information out. Cal OSHA, Washington State OSHA in particular, they have some really solid information out there, and you've got the Cal OSHA link earlier in the materials. So if you are in charge of putting together a program for your company, I would look at as many resources as possible, but try to focus on these primary ones, because what OSHA tells you is ultimately what OSHA is going to be trying to enforce down the road. Now, in terms of their guidance, I've read through a lot of this stuff. I won't say so you don't have to, because I think it's still a good idea for you to do it. But I tried to synthesize what some of the key things are. So first of all, OSHA expects employers to develop an infectious disease preparedness and response plan, stay abreast of your government guidance, and then incorporate that into your workplace-specific plans. Now, this is real important. I have a client who had wanted me to put together a 50-state chart on what the different protocols were for returning to work. And I started trying to do this, and after my head was bloody for banging it into the wall, I went back to them and I said, we need to defer this, because there's just too much in motion right now for me to give you anything that wouldn't be functionally obsolete in a matter of a day or a week. But there is a very crazy quilt out there in terms of what the states are requiring. I happen to be sitting in Delaware right now, and we neighbor on Pennsylvania. One state says if you have a 99.5 temperature or higher, that's Delaware, you can't come to work. Pennsylvania says 100.4. So what do you do if you are a construction company and you have crews in both states, some in Wilmington and some in Philadelphia? You're going to be in a tough spot here, determining how you're going to have a unified company policy. My recommendation is go with the most protective rules for the areas in which you do business. But keep an eye on this, because again, there's new iterations coming out, daily, weekly. I think in Delaware, the governor is now on their 14th emergency proclamation. And so you have to really go back through each of these to see if there's anything affecting employment in your particular state. And then some of the counties are coming out with their own things. Even municipalities are coming out with some of their own guidance. So stay on top of that. OSHA expects you to consider and address the risk levels associated with your work sites and the tasks in your work site. So what are the routes of exposure? Not just thinking about worker to worker, but the general public, vendors coming in, salespeople coming in, delivery people coming in, customers coming in. Do you have workers from one location who come to another location? A friend of mine who ended up in isolation for 14 days was exactly in that. She was in an office. There was nobody with COVID there, but someone who had been exposed at another office came over there to deliver some things before knowing they had been exposed. So as a result, both offices ended up being shut down. You're going to have to think about your travelers. I have been a business traveler, for many years now. I was pretty much getting on a plane every week. I have trepidation about the idea of getting on a plane. And one of my colleagues, not with my firm, but another safety professional, wrote a blog that I read yesterday about his first business trip and really the protocols he took from the moment that he got out of his car at the airport through getting into his rental car at the next airport, and cleaning his hotel room when he went down there, and making a decision whether to have servicing during his stay there, because that just brings more people into the hotel room and requires an additional layer of decontamination. And then what do you do when you get to the client's work site? So business travel is going to be a real stumbling block for a lot of companies who do have road warriors. And you're going to have to consider that, because OSHA does consider those folks to be on your watch when you send them out into the great unknown. Healthcare settings certainly have unique risks, and then those associated with community settings. Then OSHA says consider individuals' work risk factors. Those of us who are over 60, especially those over 65, are at heightened risk just due to age. But you have to be careful because you can't recall all your workers except those over 60 and say, well, we don't want you to get sick. That's paternalistic, and it's also a violation of the Age Discrimination in Employment Act. People who have chronic medical conditions, they're covered under the Americans with Disabilities Act. So you have to go through that reasonable accommodation analysis. Pregnancy. Now you're dealing with the Pregnancy Discrimination Act as well as Title VII. So there are lots of ways you can get jammed up. And yes, the EEOC has been, just like Osha, they're putting out guidance like every other week that contradicts the previous guidance. At the very end of the materials, I have the latest EEOC link as of April 23rd. That is the latest update that they've done. But, that is constantly changing. So if you're one of those lucky souls that has to wear the safety hat and the HR hat, I really do feel for you because you've got a lot to grapple with. You also have to consider how you're going to deal with absenteeism. Those workers who, when you reopen, can't come back to work because they're still in quarantine, or they've decided that they don't want to come back to work because they are in a high risk group. This is a big deal as an employer you're going to have to consider because a lot of the states now are saying, if you've been on unemployment due to COVID and your company reopens and you refuse the request to come back to work, you are now cut off from your unemployment benefits. And for a lot of workers, that means you're also now going to lose your medical care benefit, medical insurance benefits. So that is likely going to be addressed on a state-by-state basis. But right now, a lot of the states are taking that position that your unemployment ends. What does that mean? Why am I even talking about this in a safety presentation? I'm talking about it because this is going to force workers who may already feel like they're sick or feel that they're in a high risk group, or maybe they have a partner at home who is sick. They're going to come in because they don't want to lose any means of support, of survival and support. And if they're going to lose their unemployment benefits, they're going to come in. That is going to bring that community transmission into your workplace. And it is also going to put higher risk individuals, at a higher risk of getting sick. Now, some of the states, as you know, are building into their governor's orders, and of course President Trump has talked about this as an executive order, banning employers from suing their employers if they get sick, banning them from tort liability, banning even workers' compensability. So you're really going to have to look at this on a state-by-state basis to determine what is going on in your jurisdiction. When you reopen, you're also going to have to look at this state-by-state guidance on what you can do. Looking at Georgia, which was one of the first ones out of the gate, they allow restaurants to open, but there are 39 different requirements for those restaurants, including keeping it to 10 people per 500 square feet of public space, not counting the kitchen, no self-serve buffets, dining room playgrounds closed, redesigning your seating areas for 6 feet of separation. Because of course you can't really eat and drink when you're wearing a face mask, the sneeze mask. But that's just one state. So if you have restaurants in Georgia and in Maryland, you might have entirely different requirements. That is going to be a problem, both logistically as well as from a health and safety perspective. And if you do not follow the protocols that are set out by the state governor, whichever state you're in, when you reopen and workers get sick, there's going to be an awful lot of litigation by lawyers, like me and others, and I don't do workers' comp or tort, but who are going to say, look, that exemption under the executive order doesn't apply because you didn't follow the other things that you were expected to do as an employer under that same executive order. So there are definitely some trap doors there, I think, for the unwary. OSHA also gave some guidance on basic infection prevention measures. Most of this, if you aren't doing it already, you've been probably, asleep too long. Washing those dirty paws of yours, frequently hand washing. And that, again, is something I've had a number of clients who've been cited over the years because they didn't have adequate soap or paper towels or even, warm running water in their washrooms, or they kept them locked and didn't allow, the hourly workers to use those restrooms, made them use porta potties. Watch out for that. That is another pain point, I think, for citations. Alcohol-based rubs. If you can't have running water, you're going to have those sanitizers available. You're going to have to encourage workers to stay home if they're sick. That means paying them, because they're not going to stay home if they're not getting any money. Encourage respiratory etiquette, covering your coughs, wearing the cloth sneeze masks, providing trash receptacles so people aren't throwing their tissues on the floor and having other workers having to pick up potentially contaminated Kleenex. Also, making sure that when you are cleaning and disinfecting your surfaces, equipment, and tools, you are considering things like computers, phones that one worker might use and then another worker jumps on there. Tools especially can fall into that. Ladders would be an example. Have policies to identify and isolate potentially infectious individuals. Certainly restrict people from entering isolation areas. Encourage workers to self-monitor and report if they're feeling sick. Again, stay home, but flexible leave. Don't require a doctor's note, because people with mild symptoms are being told don't go to the doctor's office. And so they're not going to be able to get a doctor's note. And if you require them to go to a doctor or a health clinic just to excuse their absence, they're likely to be exposed again and maybe transmit that back into your workplace. And then coordinate with your insurance providers to provide worker benefits where possible and information on medical care. So that was all guidance to employers. And then OSHA put out some guidance to workers as well. They said you can discontinue home isolation as long as you check with your healthcare provider or state government to make sure that you are legally able to do so. Check what are considered essential services and activities. If you fall into that category, your employer can recall you, and as mentioned, you're likely going to have to come or forfeit unemployment benefits. Now, if you were hospitalized previously, obviously you're going to follow your discharge instructions from your physician. And again, be flexible about requiring the doctor's notes, because we don't want to strain facilities. Now, OSHA says if a worker believes they were exposed to or infected by COVID, stay home. Don't leave except to get medical care. Don't visit public areas. Keep in touch with your doctor. Call before you seek medical care, but don't delay it if you think you're getting worse, because this is a really perilous illness. And, I was reading a post from somebody I know who was out, walked 3 miles with their dog on Sunday. The next morning on Monday, couldn't walk 100 feet, and they were in the hospital with pneumonia and a septic infection that afternoon. So, went from walking 3 miles one day to being hospitalized with sepsis and pneumonia within 24 hours. This thing can be very, very tricky. Also notify your supervisor if you are found to be infected or you've been exposed, so that they can take action to keep others in the workplace healthy, and maybe schedule you to work from home or give you some flexibility if you're feeling well enough to do that. Avoid public transportation. This is a big one. We have seen, what's happened in New York City, and I'm not an epidemiologist by any means, but, a lot of fingers are pointing to the fact that the subways are there, and that was the main route of transportation for city dwellers. People in New York don't typically own cars unless they can really afford it, because it's parking and everything is very expensive there. And so that has been a route of transmission. Well, we have our DC area metro, we have our metro bus system. There's also, they're discouraging using ride sharing or taxis. But this is problematic. If you are recalling workers who don't own their own vehicles, how are they supposed to get there? And you as an employer, if you set up a shuttle bus to pick people up, that in itself is contraindicated. So that is going to be an impediment for people coming back if they are being discouraged from using public transportation. And then, of course, call 911 in case of emergency and put on a face mask before they arrive so that you're not needlessly exposing, your ambulance crews, your firefighters, whoever might be your first responders. Now, what about reporting? This is an area that has changed dramatically from when I did the first webinar for Chesapeake Region Safety Council on this. What OSHA is saying, first of all, is if you report COVID as a work-related illness, you are covered by OSHA and also by MSHA's anti-retaliation laws. And I've mentioned before Section 11C of the Osha Act, or 1904.36 in Title 29 for OSHA, and then the Mine Act has Section 105C of the Mine Act for MSHA-regulated workplaces. That includes cement plants, stone quarries, sand and gravel operations, and it also applies to contractors who are working at MSHA work sites. So if you're a construction company and you're putting a new roof on a scale house at a stone quarry and you get injured, that gets reported to MSHA. Well, if you get ill while you're at a mine site, that becomes an MSHA recordable as well. And if you are discriminated against because of reporting illness or refusing to engage in an unsafe or unhealthy activity while you're at a mine site, you have recourse under Section 105C of the Mine Act. It is different than OSHA because there is a private right of action. So if MSHA investigates but they decide not to pursue the case, under MSHA, you do have the right to file a whistleblower complaint with the Federal Mines with MSHA, and then take that, file a complaint with the Federal Mine Safety and Health Review Commission. And there are, there's a lot of relief available for the worker. There's also civil penalties under MSHA for the mine operator or the contractor who discriminated against the worker. And those are up to $270,000 now. So they are definitely higher penalties than OSHA. Now, beyond that, OSHA says the employer gets to determine the work-relatedness for recording purposes. And if a worker is hospitalized and claims it's work-related, you have to still notify OSHA within 24 hours. If somebody dies, you have to notify OSHA within 8 hours. And you're not getting to decide in that case whether it's work-related or not. You let OSHA know, they will then determine whether to pursue it or not. I've had people die of heart attacks and strokes at work sites. I had a couple of cases last year where people overdosed on drugs and were taken to the hospital. We still had to notify OSHA about those, even suicide attempts. So don't miss that, because it's a mandatory minimum $5,000 penalty with OSHA if you miss that reporting deadline. And with MSHA, you only have 15 minutes to notify them of any death or illness or injury that has a reasonable potential to result in death, even if it's not work-related. So again, if you're a contractor working at a cement plant and suddenly somebody goes down for the count, you think it might be COVID and they get taken away in an ambulance, you need to notify MSHA within 15 minutes of when the ambulance was called. That's how they pretty much time this. And I've had clients cited when they phoned it into MSHA 17 minutes after they called 911. They do check the phone records. And with MSHA, now it's a mandatory minimum penalty of about $6,500. So that's an expensive mistake to make. Now, beyond that, OSHA says to put that's reporting. Now, for recording on the logs, OSHA says put the COVID case on the log if the following criteria are met. It's a confirmed case, and you're in a high-risk sector. And remember, I gave you that delineation on that earlier. Otherwise, they said for the employer, you can assume it's community transmission and don't put it on your log. Now, if you're in a high-risk sector, you also have to make the determination that it's work-related and involves one of the recording criteria. It's a fatal. It involves medical treatment beyond first aid, restricted duty, or days away from work. If somebody, says that they're ill, but they never miss a minute of work because they feel fine, they're asymptomatic, certainly that wouldn't go on the log. But this is a big deal. I think this is a bit of a ticking time bomb here, because OSHA is saying if you are in a medium risk or low risk industry, even if, presumably you have a route of transmission, and remember things like meatpacking plants, or manufacturing facilities would fall into those medium and low categories, it doesn't go on the log. That is, even though OSHA recordability and workers' comp compensability are two different matters, as a practical matter, it's going to be harder for workers to claim comp for something that OSHA's already said likely is community transmission based. It kind of raises the bar for the employee's burden of proof on that. And I think that is going to be problematic. And the same thing, if you are, say, from a staffing agency and you become ill, you wouldn't have workers' comp as an exclusive remedy, but it's going to be harder to make the case in a tort proceeding that you acquired COVID-19 on the job if OSHA's own policy is saying, nah, probably not work related, put it down as, consider it to be community transmission. So I am holding my breath and waiting to see if OSHA is going to put out yet a third iteration on their reporting criteria here because of this backlash we're seeing, especially in the meatpacking industry. Now, on the Msha side, it is different from OSHA, and that's why I'm including that in. They say illness or disease of a minor is reportable if it may have resulted from work at a mine or if an award of compensation has been made. So if there's any possibility that they could have caught it at the mine site, you have to report it to Msha. And this is on a 7000-1 form. It has to be sent in within 10 calendar days. I've given you the information here. It's under Msha Part 50. And again, strict liability statute, you could be cited for that. There's no statute of limitations either. Now, beyond that, going forward as you're doing your assessment, I'm just capturing this for your reference, you're always going to be trying to engineer out the hazard if you can. If you cannot engineer out the hazard, then you're going to be looking at administrative procedures, sick leave policies that are more generous to encourage people to stay home until they are recovered completely. Going to what we're doing, the web-based meetings, or going to telework, discontinuing non-essential business travel. A lot of companies are going with kind of novel scheduling, putting people on alternate days or shifts so that you're minimizing the number of workers who are present in the workplace at any one time. That is a great way of doing it, and truly a number of my client companies are taking that approach. It's also a way of being able to return people to work even if it is part-time. But that, of course, can raise some implications for workers for unemployment insurance as well, because if you're getting that extra $600 from the feds and then you're recalled part-time, it does mess with your unemployment benefits a bit. So if you have workers who are reluctant to come back part-time, that's probably the reason. In addition, you're going to be having your emergency communication plans, education and training, and implementation of the appropriate safe work practices that we've been talking about. And then PPE, as with anything, it's always going to be your last resort. It does need to be properly rated for the hazard. You want to take a look at that when you're doing your PPE risk assessment under 1910.132. Typically, you are going to be doing the medical evaluation and fit test, training the workers, selecting it based on the hazard to that worker, and then they have to be consistently worn and inspected and maintained, cleaned, replaced when needed. So none of that hierarchy of controls has gone away in the face of COVID. Rather, it's more of an infrastructure that you can utilize to craft your own plans. Now, I wanted to spend a couple of minutes here on just some of the guidance that's out there that's a little bit interesting to me. You should probably be aware of. The first is the Centers for Disease Control put out guidance for these critical infrastructure or essential workers who have been exposed to COVID. Now, remember, everything we were talking about before, if you've been exposed, stay home for 14 days. CDC now in this guidance said, not so fast. If you've been exposed, but you aren't sick, and you're in a critical infrastructure position, pre-screen. Measure the employer should measure that worker's temperature and assess the symptoms before starting work, before entering the facility, ideally. I want to say there are a lot of self-checklists or self-questionnaires out there. Some of them are really good, some of them not so good. There's no hard and fast rule to use one. It's still a good idea, but be consistent. Use the same one with everybody so that your data is coming in the same way. And then with the temperature, make sure you know what the requirements are in your particular state, because it may be something different than 100.4. Regular monitoring. As long as the person doesn't have any symptoms or temperature, they self-monitor under the supervision of the employer's occupational health program. This is where I chuckle. You can chuckle with me. Ha, ha, ha. We all laugh because most employers don't have an occupational health program. So good luck with that. The next is wearing a mask. Employees should wear a face mask at all times in the workplace for 14 days after they had their last exposure to COVID that they are aware of. Now, the employer can issue these cloth masks, these face masks, or you can approve something that the employee brings in themselves. Please make it clear that these cloth masks that everybody is sewing up or using bandanas and repurposing them, they are not respirators. They protect you from transmitting COVID if you are infectious to somebody else. They do not protect you against getting it. A real N95 mask worn properly is going to be more efficacious for that. But of course, we're still seeing healthcare workers dying in droves. So that's a little bit questionable. But beyond that, if you've got a bandana and you stuck a coffee filter in it, that is not the equivalent of an N95 mask. So be very, very clear with your workers on what these will and will not do. They need to understand the limitations. Otherwise, again, they're going to think that they're 10 feet tall and bulletproof, and they're going to be out there getting sick. Social distancing. If you have critical infrastructure workers who have been exposed to COVID, they should try to stay 6 feet away from others as work duties permit, which basically means, if it's convenient. Beyond that, disinfect and clean workspaces, all of the routine cleaning of the areas, the offices, bathrooms, don't forget those, common areas, lunchrooms, break rooms, locker rooms, and any shared equipment and tools. This is, again, for everybody we've been talking about, but they're saying especially if someone's coming back to work after they know they've been exposed, maybe they have a sick spouse at home. Now, if a worker who has been exposed but otherwise passes these tests becomes sick during the day, send them home immediately and then clean their workspace. And make sure your folks understand the difference between cleaning something, disinfecting something, and sterilizing something, because these terms are used in different ways in the guidance and they all have different perceptions, or rather, they all have different technical meanings. Your perception of them may be that they are all the same, but they really are not. And then beyond that, information on people who've had contact with the ill worker. That's your contact tracing, both during the time of the symptoms emerging and also tracing back for 2 days prior to the person becoming symptomatic. You need to compile that. And then anybody within 6 feet of that infected worker should also be considered potentially infectious. And you're starting now back at the top of the slide, pre-screening once again. But this is what CDC is recommending at this point. Now, Osha has put out some guidance specific to the meat and poultry processing sector. I included this in here because obviously in the Delmarva area, we certainly do have a lot of chicken processing facilities. There are meat packing, crab processing facilities that are in our area. There's been a lot of outbreaks in these. OSHA stresses people are not being exposed through the meat products themselves. I'm not entirely sure how they come to that conclusion, but that's what they're saying. But they note that the work environment can contribute to this through the processing lines, having busy areas where you're jammed in close contact, having long duration of contact, and then very common practices in these sectors, including having ride-sharing vans and shuttles, carpooling, and the public transportation. We talked about some of that before. So what they're recommending, OSHA is recommending for the meatpacking and poultry processing, is to designate somebody as your qualified workplace coordinator who's going to have the responsibility for assessment and control planning. There's a lot of detail for them in this guidance. I'm really capturing, about 5 pages of things here quickly. Consider the appropriate role for testing and also that workplace contact tracing of positive workers using your CDC guidance. Beyond that, for controls, they recommend engineering controls. Keep people 6 feet apart at all times if possible, but also changing your production practices, installing physical barriers. We're seeing those already in the supermarkets, for example. Using physical markings and signs. We're seeing that if you have come out of your hibernation to go to the market, you know that they've got tape typically on the floor, so people in line stand 6 feet apart. Of course, people blow right past that, which is scary. And some of the supermarkets are having their aisles one way now to, again, reduce coming face to face with other shoppers. So those are some things. And in fact, if you look at the OSHA guidance on meat packing and poultry, they have some diagrams on how you could redesign your workstations to prevent people from being as close to each other as they normally are. They recommend bringing in an HVAC engineer to make sure that you have adequate ventilation, but they want you to minimize the use of these fans that blow the air from worker to worker, or the use of personal fans. These are hot work environments, and people do like the fans, but this can just blow the infected particulate matter around. And some studies in China even seem to suggest in one restaurant that the ventilation system in the restaurant that flowed over a table of people who turned out to be infected ended up infecting people at 9 other tables. So those are some things to think about. How much ventilation is good ventilation? How much is actually going to exacerbate the situation? And then, of course, your appropriate cleaning, sanitation, disinfecting processes, hand washing stations, sanitizers, maybe reconfiguring your time clock stations, set up multiple ones so you don't have 20 people all standing around together trying to clock in on time. They suggest putting up tents for, and again, environmentally, if it's warm enough to do this, have outside break and lunch areas, and then avoid overflow and overcrowding in your training and your conference rooms. So you can see a lot of these protocols are the same from industry to industry, but there are going to be unique considerations depending on the sector. For construction, just to use that as a comparison with the meat packing, 6 feet between workers where possible to prevent spread. But, if you're carrying some equipment that takes 2 workers and it's less than 6 feet long, you're going to be within 6 feet of each other. Maybe figure out, can you use a mechanical lifting device for that instead? If you're working in healthcare facilities as a construction worker, remember that you are going to be subject to infectious control risk assessments there. The Center for Protection of Workers' Rights has some really good stuff on that, so I'll give them a shout out. Hold meetings, toolbox talks outside, similar to what they recommended for the meat packers. Have your office staff work from home if they can. Make sure your supervisors are walking the walk, and this is a big deal. Just like with any other kind of PPE, if your workers see that supervisor wearing an N95 mask, but they've got it down around their chin, or they're only wearing it with one strap, or they've cut a hole in it to smoke a cigarette. Yeah, I have seen that. They're going to think it's okay for them to do that as well. one person in an elevator at a time, where that you can do that. The hand washing before eating, drinking, or using tobacco products, the soap and running water on the job sites, or the 60% alcohol sanitizer. And then again, cleaning and disinfecting any kind of high touch surfaces, especially those that are capable of being shared. So I hope that, running through these protocols has brought it home to you that there's, a lot of commonality in how an employer can approach things, but you have to watch for the unique nuances for your industrial sector. Now, beyond all of that, OSHA clearly does not have an infectious disease prevention rule. I went through these in a lot of detail the last time I did this for Chesapeake, and I'm going to give you the snapshot now. Remember that OSHA has other tools in its toolbox to issue citations for employers who just blow off their responsibilities here. The General Duty Clause, Section 5A1 of the Osha Act, allows OSHA to cite an employer if there is a recognized hazard, which COVID-19 certainly is, that has the potential to cause death or serious injury or illness to workers. It certainly does. You have workers exposed. That's always the $64,000 question. And is there a feasible method of risk mitigation? And OSHA has all this guidance out now, so you can't put your head in the sand and claim that you don't know how to begin approaching this. There's lots of stuff out there. Knowledge will be imputed to you. If you belong to an association, and they're furnishing information, or you're attending webinars, that gives you actual knowledge of the need to be responsive to this. Beyond that, you have your general PPE requirements, your eye protection, and don't forget that, because you want to be wearing goggles if you are in a high hazard sector where infectious materials could splash into the eyes, or particulate could. The respirators, 1910.134. 1910.138 is hand protection. A lot of workers now are using cleaning products in ways that they never did before. That may make those products cross over into OSHA HAZCOM territory. You're going to have to do training on those, and you're going to have to make sure that you're using the right gloves. Beyond that, sanitation, that's your washing facilities, toilet facilities. Medical records access, that affects your medical evaluations, records that you have to hang on to under OSHA's medical records access rule. Bloodborne pathogens, there may be some crossover there. And then the HAZCOM standard, and also laboratories that deal with hazardous chemicals. Laboratories are considered to be high-risk work environments, especially those that are analyzing either biological samples or doing the test kit analysis. And then remember the reporting and recording requirements, which we talked about already. So those are the main OSHA things that the tools that are out there. I've captured the general duty clause. I told you about this already. The only other trigger here is that it has to be your own employee who is exposed. So if the only people who are exposed are third-party workers, you cannot be cited under federal OSHA for the general duty clause. There are a few states, though, that have exceptions to that, so watch out for those. Beyond that, whistleblower protections, again, I've talked about this quite a bit. There are those new procedures. Back as of the middle of April, federal OSHA had gotten over 3,000 COVID-related hazard complaints and 400 whistleblower complaints, and I think that's why they said, no masks, so we can't investigate all of these. Oregon OSHA, a little state plan, in early April, they had already had 1,000 worker complaints related to COVID. I don't even know what Maryland OSHA or Virginia OSHA have gotten. So don't expect that you're going to have a lightning quick response from OSHA on any whistleblower or hazard complaints that are filed, unfortunately. Now, beyond that, with Msha, I won't spend much time on this. They are still inspecting. They are doing their mandatory two times a year inspection, surface, 4 times a year underground. They will capture any contractors who are there. They have suspended their educational field services and their small mine services. And they say if you have a mine and you have to shut down short term because of COVID, please notify Msha and file that report, and then notify them again when you reopen so that they are not straining their own inspector resources coming to visit you. And like OSHA, they are extending the deadlines for certain things: annual refresher training, certification of the people doing the sampling at coal mines, maintaining or calibrating the equipment there, audiometric testing. But they are not extending any deadlines on new miner training. You cannot start work at a mine unless you have had your new miner training. And different from OSHA, if you want to get one of these other deadlines extended, you have to call the MSHA district office and let them know. They will grant it. That's not a question. But if you don't document that you've had this discussion and have a meeting of the minds on what the new due date is going to be, you could get into trouble. And for our region, the district office is located up in the Pittsburgh area in Warrendale, Pennsylvania. So they are continuing to inspect. They're not going to jump in your truck with you to go around the mine. They will take their own vehicle. They're going to minimize group meetings, but they are going to speak individually to miners, and likely health sampling is going to be deferred because that requires the inspector to get up close. But you cannot refuse to let the inspector in. And if an inspector is manifesting symptoms, call the district office right away and let them deal with the situation. And remember to document task training if you have workers who are filling in for other workers at mine sites as a result of your workforce shrinkage. DOT, real quick, they recognize that workers don't want to go to get drug tested at a clinic if it's going to expose them to COVID. And so while they are not allowing you to start a safety sensitive job without a negative pre-employment test, you can, other than with Federal Aviation Administration, you can be hired for a non-safety sensitive position and then tested later. There are unique requirements for the different modalities of transportation, and I've given you a link there. Just like with OSHA and MSHA, they want you to make a good faith attempt to get her done. Have some backups if possible for your blood alcohol technicians, your medical review officers, your substance abuse prevention professionals. But they say if an employee refuses to be tested because they don't want to go into a clinic and you don't have a mobile testing facility available, try to be flexible, work with the DOT, look at their requirements, but don't automatically report that as a refusal under Part 49 CFR 40.355, because that is going to potentially blackball somebody from working in the industry. Captured for you here, I'm not going to go through it, PPE requirements and respiratory protection requirements. Fit testing, talked about that already. Their guidance now has discretion not to cite you for the annual fit testing violations, and that has been expanded now across all industries. For healthcare, they recommend using the N99 or N100 filtering face pieces, which will screen out 99% or 100% of the infectious respirable particles, rather than 95% as the N95s do. And they also have some recommendations on fit testing to preserve the supplies. Record keeping, we've talked about this to some extent already in terms of the recording and the reporting. Just remember, you have to keep your medical evaluation records if you're mandating somebody wear a respirator. Now, cloth masks are not a respirator, so they don't fall under mandated respiratory protection requirements under 1910.134. And what about the voluntary use? If you give somebody an N95 to wear, that is a respirator. And if you say you can wear this for comfort or for your peace of mind, then it falls under this. You have to post Appendix D of Part 1910.134 in the workplace, review it with your workers. I still think it's a best practice, even with the cloth masks, but make sure that people, again, understand these are not going to protect you from being exposed to COVID-19, they are going to protect you, the cloth masks, from exposing other people. And don't share these, don't wear other people's. And consider, if you're providing these cloth masks, the issue of take-home contamination. Maybe you want these to be disposable. Maybe you want to launder them at the work site, because if a worker takes home a cloth mask you give them, has their wife wash it, and she becomes ill, you might have some tort exposure there potentially. And then, of course, don't forget the labor law issues. We talked about a few of those already, and I've given you the link to the latest EEOC guidance on COVID. You know, basically, can you test people? Yes, you can take temperatures. You can do the self-questionnaires. The EEOC has said for now, they are not going to consider that to be a violative medical examination under HIPAA or under the Americans with Disabilities Act. If people have been exposed but have no symptoms, you're supposed to self-quarantine, but they do have that exemption for the critical infrastructure workers. And can you terminate workers for absenteeism if they're under a mandated quarantine? Probably not. Some states even have that right out there that you have to pay them. And of course, you've got the feds. For certain employers, you have to pay as well. But if there is no law that applies and they've already exhausted their leave, you can put them on unpaid leave, but keep an eye on new legislation. And then once the quarantines have been lifted, if they're not sick and they don't return to work, that could be considered a voluntary quit. Now, can you require FMLA leave? If they have actually been diagnosed with COVID-19 or they are caring for an immediate family member who is ill with it, yes, as long as they qualify for it and you're an employer who is subject to FMLA. But if they are sent home to quarantine because of exposure, but they are not diagnosed as ill, that does not qualify for FMLA leave. And then a last thing, I know we're at the bottom of the hour here, I will take questions. I just wanted to give a shout out to the National Safety Council because they have joined with other safety organizations, but really taking the lead on it, and also Fortune 500 companies, and they have formed the Safer Task Force, that's the name of it, to guide employers through this whole process of returning to work. And I've given you a couple of links there. If you want to get involved, there's an email you can send to get on their mailing list. They also have a landing page. And the Safer Task Group is going to issue recommendations and develop guidance for employers of all sizes. So even though this is being, spearheaded by Fortune 500 companies, they are going to have resources for the mom and pops as well. They're going to identify the complexities in re-engaging your workers and contractors, and they're going to be taking a holistic view, including HR, legal, labor, healthcare, and workers' comp providers, not just the workplace safety aspect. And then they're going to develop some sector-specific playbooks to help businesses align their worker safety with your business objectives. Because while there's a lot of talk about is shutting down businesses more hazardous to workers' mental and economic health than having them return to work, I'm not going to get into that debate. But certainly there is going to be a tension between getting your businesses started up and doing it in a safe manner. So the National Safety Council and, of course, Chesapeake Region Safety Council can be your allies in this fight against COVID. So thank you so much for your attention. I will pass it back now to our moderators to see if we have any questions.
Thank you, Adele. I believe that almost all of the questions that have been posted were answered during your presentation, but
that's wonderful.
I'll pull out a couple of them. Are the KN95s allowed for silica and construction in lieu of the N95?
Well, right now, I would say no. And Osha has been really looking at using these for COVID transmission, and it's on a temporary basis, allowing these non-NIOSH approved respirators. Msha, by the way, will not allow the use of KN95s. I asked that at a stakeholder meeting they had, so just be aware of that. But as a practical matter, if you have N95s, I would preserve these for use for your construction and other workers for things like silica and beryllium hazards, because you don't want them to get into the practice of using a lesser level of protection, even if OSHA is going to give you a free pass on it in the short term. We know now that these KN95s are not passing fit testing. We know that there are some manufacturing issues with them. And, you know, if somebody develops silicosis as a result of using inferior protection, you know, OSHA may say you don't have to pay worker, or they don't say anything about workers' comp. They may say you don't have to record a COVID-related case, but you're going to have to record a silicosis case. You are going to have to pay comp on that. So I think it's just a best practice not to get sloppy about the use of the N95s.
Thank you. Another one came in from Tom West, and he said that he's seeing a lot of businesses and hospitals requiring people to sign in and state that they have not had a fever. Is this a recommended way for businesses to screen people before they enter the facility?
I think it is a good idea. And just like we talked about the self-questionnaires for employers, and that's for employers to use with their workers, and that's in a couple of the best practices. You can do that to third parties coming into your workplace. Now, you may have people who say, I'm not going to tell you, or I don't want my temperature taken, or I'm not going to wear a mask. And just like with anything, the host employer has the primary responsibility because you have that authority to prevent people from coming in. Now, train your workers on what their rights are and, of course, how to handle things safely and tactfully. I'm sure we're all horrified over the report this week about the security guard at the Family Dollar store who got shot in the head and killed by a disgruntled customer who objected to being told to wear a face mask. We can't have that happening at workplaces across the country. We just can't. But you know, you have to set the tone, and if you're allowing customers and third parties to come in without being screened, then all of the screening and temperature taking you're doing for your workers is pretty much a wasted effort, in my view.
Okay. Last question. We have it's from Caitlin McGee. We have clients requiring that we ask our employees if the employees' contacts have had close contact with others as a screening exclusionary criteria. Can you offer an opinion on the appropriateness of this question?
Well, I would say, you know, in my view, that is kind of a meaningless question because, you know, you know who you've been in contact with, but you don't necessarily know who those people have been in contact with. And so, you know, going back to my earlier statement, would be something of a scientific wild ass guess. You know, if you're homebound, you know that you haven't had contact, or it's been really limited to the UPS driver or something. If your spouse is going out to work every day, you have no way of knowing who they have been exposed to. And so people are going to say there's been no exposure just so they can stay on the job. And you're putting your workers in really a tough spot, I think.
We've had quite a few questions regarding this particular webinar and its availability. So we want everybody to know it's going to be on our website. It's already been posted to Facebook Live, and you should see the slides and hear the webinar later today. If not today, then tomorrow. As always, Adele, you're totally amazing with the amount of information that you are willing to share with us. We're grateful. For everybody who didn't get your questions answered, I'll send them to Adele, and she can pull through them and perhaps answer those that have not been answered during the presentation.
Yes, I'd be happy to do that. Yes.
Thank you. If you enjoyed today, next week we have Kate Kavanaugh. She's going to talk about air quality and COVID and cleaning and PPEs. And so that'll be another applicable and very appropriate webinar that we're holding for everybody. And you should see registrations for that in the next day or two. Thank you for joining us, everybody. We hope to see you back again soon. And Adele, thanks so much. Bye, everybody.